Republicans are fighting to take back Congress, so what happens if they win? Do they have a plan to quietly chip away at President Obama's agenda piece by piece, and how would that work? Joining us live is Republican Congressman Greg Walden, chairman of the House Republican Leadership. Good evening, sir, and tell me, what is this?
Well, this is the Obama health care legislation.
All of it?
This is the start. This is the law. 2,309 pages right there. Double this, Greta, and you have the regulations that have been written in the first phase through last Friday. 4,100 and some pages of regulations just coming out of the starting blocks. So we're just now beginning to see this 2,300-page bill, which, by the way, nobody in the House read before it became law. It's already doubled, in effect, in regulatory issues.
All right, now, if the Republicans win the House, is it your plan to repeal this and the 4,100 regulations plus or whatever it is, or are you going to chip away with it? What's the plan?
You know, our goal would be to repeal and replace. And we know there needs to be meaningful health care reform. This is not that. Now, the simple law of physics and the Congress is you have to have a majority in the House, probably 60 in the Senate, and a president that would sign a repeal bill. So absent that, then I think we have to draw a very clear spotlight of oversight and hold the administration accountable and have them actually explain what they meant in this huge legislation and bring them up to Congress and have meaningful oversight. You know, we haven't had any meaningful oversight in the last couple of years, and certainly in the entire duration of the Obama administration.
And by oversight, you mean hearings?
I mean hearings. Let's find out what's really in it. Remember, Speaker Pelosi told the National Association of Counties, we need to pass this law so you can find out what's in it. Well, it's time to find out what's in it. And it's time to identify the things that are most egregious, things like taking money away from seniors on Medicare, things like, like coming out today, where college kids who have always had access to affordable health insurance now are being denied that because these companies are saying the way this is written, they can't afford to be in that business any longer.
I read someplace in the last day or two about the hiring of IRS agents to begin this whole process of collecting on this mandate. And the first thing I thought of when I read it is that I remember deficit neutral is what the bill was supposed to be. If we're already beginning to hire people now, that's not deficit neutral now because we're going out and adding to it. It may not be a huge amount of money compared to the overall cost. And the mandate and the health insurance doesn't kick in until 2014. So it's sort of like, you know, there are expenses that are beginning to creep up on us.
Right. And they have fully understated the cost of this legislation. You know, originally it was argued by the administration and the leadership on the Democrat side in Congress that this bill pass it and we'll bend down the cost curve. We'll make health insurance more affordable and available. Now we know, now that it's law, that that's not the case. And in fact, it adds to the deficit, it adds to costs, it creates an enormous new burden on the next generation and this one, frankly. So one of the things we could do, if Republicans were in control of the purse strings in the House, is deny funding to add those IRS agents. You know, we can pass legislation, put it in spending bills that restricts government spending.
Except what the bill, though, was supposed to do is that the mandate was supposed to fund it. I mean, the amount of money that people contributed so that it would be deficit neutral. That's also being attacked on a couple fronts. It's down in Florida with the 20-odd states. You've got Virginia, you've got Missouri. So also that the funding's being attacked. I mean, I don't know how the courts are going to rule, but it's being attacked, the funding aspect of it.
No, I'm not a lawyer. But it seems to me,
bragging.
It seems to me that it is a horribly dangerous precedent to allow the United States Congress to mandate to you on what product or service you have to buy with your money. Now, it's always been assumed we can tax you and spend the money. But we have never crossed that line in the Commerce Clause.
Which is sort of interesting because that's the one thing it wasn't called as a tax, and in court now the lawyers are calling it a tax for the government so that they can get it under the taxing power of the government, which is sort of interesting. But the flip side plays games with the words as well.
But here's the problem with the individual mandate. First of all, it's this new penalty on individuals and this new mandate, which I believe to be unconstitutional. Second, the way this is constructed, you can wait. You don't have to buy insurance. You just pay a penalty if you're caught. That penalty at year 5 is $695. So what logical consumer is going to buy insurance until they get sick?
Yeah, you'd rather game it. It makes much more sense to game economically. Maybe not morally, but economically. Anyway, Congressman, thank you, sir.
It's good to be with you. Thank you.
Next is a government